I was asked to talk about platelet dysfunction in MPN because, as you all know, the main problem of patients with MPN is thrombosis. Sometimes also it's bleeding, and given the major role of platelets, both in thrombosis and in control of hemostasis, and also because platelets belong to the clone, a malignant clone in MPN, it was kind of suspected that MPN platelets, platelets from MPN patients would be somehow abnormal. And so the question was whether they would be more hyperactivated and thus would be promoting thrombosis, or whether they would be hypoactivated or deficient and maybe could account for the bleeding risk in that is sometimes observed in these patients. So to answer that question, many studies have been performed these last 20 years, let's say. And I think if we can recapitulate globally what this study says, is that platelets in patients are more hyperactivated. It was quite debated because sometimes when you take out the blood from the patients, the platelets, which are probably hyperactivated in the body, became activated in the tubes when the blood is drawn, and then the platelets that are studied, which are again in the tube, have been already activated, and so they are kind of ghosts of platelets. So that's why also some tests can show hyperactivated platelets. But indeed, in the body, there are increased markers of platelet activation. So I think altogether, we can be quite confident that the platelets in these patients are hyperactivated. Which is also the rationale to give aspirin to these patients as an antiplatelet agent that has shown to be beneficial in terms of reducing the thrombosis in patients and the mortality that was associated with thrombosis. Besides, the one question that was also raised was whether or not the platelets from calreticulin mutated patients were less hyperactivating than platelets than patients with a JAK2 mutation. And I think also, to make a summary, there is currently no evidence that calreticulated mutated platelets are less active than JAK2VF platelets. Another interesting aspect of the role of platelets in mediating thrombosis in patients is that, well, everyone is aware that platelets play the role in thrombosis in themselves, but also it was also shown that platelets can promote thrombosis by activating neutrophils. And when neutrophils become activated by platelets, they can form neutrophil extracellular traps that promotes thrombosis. And a study we've recently published shows that JAK2VF platelets are able to promote neutrophil activation and subsequent net formation and then thrombosis. We've shown that in the mouse model, and also in patients there are some evidences for this process. So therefore, inhibiting platelets, or at least decreasing their activation using aspirin, is beneficial for the proper role of platelets in hemostasis and also for their role as activating neutrophils.